This is Heart Rhythm TV, and I am Julie Shea, here with another episode of Advancing Allies. With me here today, I have Dr. Kamala Tamalisa, who is a cardiac electrophysiologist at the Texas Cardiac Arrhythmia Institute in Dallas, Texas. And I also have Tara Parham, who works at the University of Pennsylvania. So welcome, ladies. I'm glad to have you here. Now, you are both members of the DEI Council for the Heart Rhythm Society.
Yes.
So can we talk a little bit about diversity and why this is so important to understand diversity better as it applies to our practice?
Great question, Julie. So diversity is very important because from the patient standpoint, we all would like to focus on equitable healthcare. I don't think anyone disagrees with that. And equitable healthcare, we have data about sex concordance and race concordance in patient care delivery. So a female physician provides better care, and this has been shown in post-MI patients with diabetes, and same thing for allied professionals. You know, they are an integrative part of the care we provide to our patients. So I would imagine that there's no difference, even though we do not have exact data. But ultimately, health equity is the goal. And how do we reach that health equity? Through diversifying the workforce, widening the training pathways, and working together by supporting each other.
Yeah, absolutely. How do you think the Heart Rhythm Society fosters a culture of inclusion from its members of diverse backgrounds?
Could I take that, Tara?
Yeah.
So, we as a council, Tara and I have been on this council. We've done incredible amount of work. We started with data collection. Number one is knowing where we stand. How many allied professionals are there? How many underrepresented racial ethnic groups are there within the organization in the professional society, and how many women physicians are there? And we as a council have defined for the first time that underrepresented racial ethnic groups are these and women are these. So we know the numbers, and HRS as a leadership has supported immensely these initiatives. With that, we set some midterm goals and long-term goals, and we've been moving the needle. And Tara can fill in if I missed anything, but we truly have been moving the needle.
Yeah, definitely. We looked at what our our provider population looked like within Heart Rhythm, and we were able to determine where there was some work to be done. And so we've been doing just that. We've already been able to achieve the goal of increasing our female physicians, as well as making sure that we have diverse panels during all the sessions of Heart Rhythm. So we've done a lot of work with that, and more to come. So
yeah, and
really
I think,
exciting.
the leadership programs that we have available, so LEAP for allied professionals, and GLOBE for Black electrophysiologists, and GLOW for women electrophysiologists has really helped to promote that diversity for 100%. Sure. So how can the Heart Rhythm Society assist healthcare providers in providing more equitable care to our patients? I find this, it's very challenging. It's very challenging when you have patients come into the office and they don't speak English, and trying to have that time carved out to give them the information that they need just as you would anyone else. But, as with interpretation and things can take longer. So it's so important. And any suggestions or any tools that, we can use for providers to help bridge this gap a little bit?
Yeah, I'll take that one. So things that I think of or come to mind right away are just making sure that the resources are available. So in that way, I say making sure that if CPR training for communities and community centers and churches and things like that, it takes money. It takes resources for that. So sources like that will be awesome. Also making sure that wearables are available for our patients so that they can maybe detect atrial fibrillation sooner within our population would be things that Heart Rhythm could do to help providers. Because again, the lack of time, the lack of resources is the reason why it doesn't get done at times. So that I think will be a huge push. And then also just making sure that any type of research among underrepresented groups could be supported would be, I think, also a wonderful thing that could be done, because that's where a huge disparity lies.
So, Tara, what are your recommendations to allied professionals seeking to improve? What are some direct deliverables that can help to improve their delivery of equitable care?
Yeah, so making sure that you meet the patient where they are, talk to them, see where the lack of adherence comes from. Again, sometimes we make assumptions that the patient just doesn't want to take their medication. Well, maybe they can't afford their medication. So each time you encounter them, you make sure that they are able to get their meds, getting them to the 1-800 numbers and the resources that may be able to get them coupons or, affordability programs, and connect them with the companies and the pharmaceutical companies that can get that to them. Yeah. So again, just not making those assumptions. Right. Also making sure that patient health literacy is there, so that they understand their disease process, what needs to be done, what steps need to be done, and also involving family members, because family members are key to that holistic care approach that we need. So again, just making sure that you carve out that time. And yes, it does take more time on the front end, but again, that continuing ongoing relationship that you have with your patients is key.
And I think improving their trust in you.
Definitely.
Important. And, it's kind of a upfront investment for a good long-term investment if you're getting these patients medications properly.
Yeah.
And, I think your point to involving family, particularly younger family members, where they may, be able to speak English and help bridge that gap.
Yeah.
A grandparent or someone is so important.
Mm-hmm. Yeah, a couple of things I would like to add to everything that we've discussed is, as a professional society, as leaders in our own institutions and individuals, I think we need to make a committed effort to close in the gaps from the community side. Healthcare systems can invest money and adopt zip codes around them and try to help those community initiatives. This has always been my idea in my mind.
Yeah.
And then industry, please reach out to underrepresented racial ethnic groups when you're sponsoring a research trial. And also make sure every research trial has very good representation of the racial ethnic groups and who are underrepresented, and also women in those trials, so they become more meaningful and customized at the same time, without generalizing. Yeah. The last thing, if I may say, is the AI, we are moving towards a direction, unless we are intentional about the data input, we will widen these gaps. So it needs a lot of intentional and continued efforts.
Yeah, for sure, because a lot of them don't have access to those particular types of wearable type items. So
Exactly.
Well, that's great. Well, thank you, ladies, so much for meeting with me today. And, this diversity and equitable care is so important. And I thank you for coming today to bring that to the forefront.
Of course.
Thank you.
Thanks for having us.
This is Julie Shea, Heart Rhythm TV. Thank you for watching.